Hello, welcome. My name is Natalie Merck. I'm here today from Geneva, from the Geneva Health Forum, from unfortunately a confined Geneva, but nonetheless the show must go on. I work at Merck in the Access to Health team, but today I will be your independent moderator as an eternal global health enthusiast. Today's topic for our panel is open innovation for infectious diseases. I have an esteemed panel with very different backgrounds on the topic, different types of experience, and so we hope to get different perspectives on this important topic. So what is the purpose of today's session? We're going to look at defining open innovation, understanding why it is important for infectious diseases, understanding how it intersects with intellectual property and science, collaboration, why it's so important, and also how our panelists see this field evolving over the next 10 years. So with me today in the studio, I have Thomas Spangenberg from Merck. He has almost 20 years working in chemistry in various fields, both public and private. I have Charles Randolph here from the World Intellectual Property Organization. He has over 25 years experience as a diplomat, including in the area of intellectual property. Virtually joining us, I have Benjamin Perry from the Drugs for Neglected Diseases Initiative, who Ben also has over 20 years experience in medicinal chemistry. And last but certainly not least, I have Dr. Kelly Trevally from University of Cape Town, extensive experience working in organic chemistry. So we're delighted today for our panel, and we'll get started in an interactive discussion for the next 30 minutes. Hopefully having around 10 to 15 minutes at the end of this discussion for an open audience question and answer session. So to start, I will start with Charles and kind of an opening question, just in terms of sharing some insights about what you're doing at Wipo, who you are, what's your title, what division you're working in, just to get the conversation started.
Thanks very much, Natalie, and thanks for the opportunity to be here this morning, or this afternoon, rather. I started at Wipo approximately 3 years ago, and my title is Head of Global Health. And there, my primary responsibility is managing our public-private partnership, known as Wipo Research. We also, in our division, cover the trilateral cooperation, which is our health-oriented discussions with the WTO and the WHO, and I have a very esteemed colleague there who leads that effort. So that generally gives you an idea of the types of issues we're looking at. Thank you.
Perfect. Thomas, can you give a little bit about what you do at Merck?
Sure. Hello, everyone. At Merck, we have a Global Health Institute that focuses on R&D activities in view to deliver innovative health solutions for underserved populations. More specifically, with our colleagues, we are working to contribute to the discovery of new treatments against infectious diseases like malaria, that everybody I'm sure is aware of, and a more neglected tropical diseases like that is caused by worm infection that is termed schistosomiasis or bilharzia, for which we've been historically involved as we were part of the discovery of praziquantel, an essential medicine. On a more operational level, we work in partnerships, essentially in public-private partnerships, where on one hand we leverage on the industrial know-how, and on the other hand we rely on our collaborators for their disease expertise and beyond.
Excellent. Virtually joining us, Ben, can you tell us a little bit about what you do at Dndi?
Sure. So I'm working in the discovery team at Dndi. Dndi is a product development partnership. We're about 250 people worldwide working mainly in neglected tropical diseases. We cover the whole range of the, say, pharmaceutical pipeline in terms of early stage drug discovery right through to launch of new medicines and access. My particular focus in the discovery team is on leishmaniasis and Chagas disease, but we are also active in a number of other areas, including most recently in pandemic preparedness and working on coronaviruses. And we're a virtual organization, so collaboration, open innovation is very much at the heart of everything that we do.
Excellent. And Kelly, you wear many hats working at Cape Town. So can you give us a little bit about what you do in terms of working in the chemistry department, but also you have other positions that you fill?
Thank you, Natalie. Thanks for this tremendous opportunity. So here at the University of Cape Town, as you said correctly, I wear many hats, but the one hat I wear is, of course, I have an academic appointment, and so I have an academic group where I train graduate students, PhD students, and postdocs. And then on the other, I direct the University of Cape Town Drug Discovery and Development Center, which we call H3D. This is an integrated drug discovery platform, and I lead a team of chemists, biologists, and pharmacologists working together in an integrated fashion. And the focus of our work is broadly in global health drug discovery, and our focus areas are malaria, tuberculosis, and antimicrobial resistance, and much more recently, schistosomiasis, which Thomas, my colleague, earlier introduced. Thank you.
Okay, perfect. So now we have introductions. We'll start moving into more of the subject matter of this session. So Charles, I'd like to come back to you to first understand a little bit more about open innovation, what it means in your role, and particularly for your organization at Wipo.
Sure. Well, before getting to open innovation, I think I'd like to underscore the role that innovation plays in discovery overall. And we find ourselves in the midst of a global pandemic that has only served to accelerate an already ongoing trend in technology and research and development and innovation. And in that sense, intellectual property is essential to those fields. And it's essential for a number of reasons. I mean, it gives people the confidence to invest and to continue research and development, and it also helps contribute to economic development. And so that's broadly speaking at where we approach it from Wipo. We manage the international intellectual property system to help spur innovation for the benefit of all. Now, in terms of open innovation, our particular initiative that I manage is known as Wipo Research. And Wipo Research is a public-private partnership dedicated to advancing early-stage research on neglected tropical diseases, malaria, and tuberculosis. So we're not a drug developer. We're really focused on the early-stage R&D. And what we do is we connect researchers with company scientists and leading pharmaceutical companies that have intellectual property assets that could be useful in their research. Often, we're repurposing molecules and compounds that have already been used for other research lines. And so we connect those, make those introductions, and then we follow through the collaboration on that type of research, whatever particular disease category they're looking at.
Excellent, thank you. Now for a different perspective from the private sector, Thomas, can you give a little bit more insights in terms of what open innovation means, particularly to Merck and the organization you work with within the company?
All right, so I would define open innovation as a collaborative R&D model where innovation is based on sharing data, knowledge, and know-how between stakeholders. So quite a simple definition from my standpoint.
Excellent. Now, Ben, at Dndi, you're working with all different types of stakeholders, many of whom are on this panel. So can you give us a little bit more in terms of what it means to Dndi, and what are you doing, maybe on a daily basis, how you feel you're contributing to this overall? I know it's a big
Sure.
question.
So pretty much everything that we do at Dndi could fall under the umbrella of open innovation, because every single project we work on involves collaborators, and sometimes, in most cases, many collaborators working in parallel, and we have tens of projects ongoing at any one time. So I think the Dndi model and others like it, the MMVs and TB Alliances of the world, are really exemplary in terms of open innovation and the successes of open innovation in pharmaceutical research. And we work with pretty much everybody. We have collaborators, obviously, on the industrial side, such as Merck. We have collaborators in the academic side. We have collaborators in government organizations. We obviously do a lot of work on the policy and advocacy side as well. So really a very, very broad palette of collaborators. And we've learned a lot about how that works and how to manage that, and also have demonstrated how that can really impact positively both innovation, coming up with new discoveries, as Charles mentioned, but also driving projects forward and getting things into the hands of doctors and patients. We use the term open innovation at DNDi a little differently because yes, it does cover everything that we do. Within DNDi, the open innovation term is a little bit more focused on what we would call sort of maybe the capacity strengthening and novel research mechanisms, new ways of doing things. So outside of our usual way of working, which is just straightforward collaboration, some of the slightly quirkier, more interesting, more adventurous types of collaborations, very much let's see what happens if we try and do this. And we have a few examples. Hopefully I'll touch on those later.
Perfect. And Kelly, from an academic perspective, also particularly in your role in University of Cape Town, but also in your experience working, with different types of organizations throughout your career, how would you define open innovation also in your daily work, and how do you feel you're helping to drive this?
Yeah, thanks, Natalie. Actually, the meaning of open innovation for me is very much aligned to what Thomas said earlier. And so it's really when in a pre-competitive space with a network of partners where you share expertise, you share knowledge, you share data in real time. And because you're doing the project that is of interest to all the partners involved, then of course it becomes critical that is openness in the way that we share information and knowledge for the sake of moving the project forward. So our specific models that we work on in terms of the pre-competitive network of partnerships is really involving academia, of course, which I represent, and then industry or the private sector, which Thomas represents. And of course, we also have a program with Thomas, but also the virtual not-for-profit R&D organizations exemplified by Medicines for Malaria Venture, who are also our partners. But also importantly, and this is really, really important for me to emphasize, is also government participation. So it's academia, it's industry, the sector, it's a not-for-profit product development partnership, and it's government. And I'll come back to this later if I have the opportunity, because I think government, for us in practice, has been playing a very critical and direct role in enabling this collaboration.
Kelly, thank you. And thank you to all the panelists. We have a lot of themes circulating that we hope to delve into in the next minutes. So the first one is what I'm hearing is that there's this intersection in open innovation on intellectual property and science. I'm not sure if our audience is aware, but we have 3 chemists, and we have also someone from a more diplomatic space, from the UN space. So I think it's interesting. It shows that there's not really one skill set that you need for this topic to work in it. You need different types of experience, different types of skills and expertise set. So Charles, I'm going to start with you in terms of in this sort of intersection of IP and science. What is your perspective on it? And particularly an organization like Wipo, you gave us some insights earlier, but delving into more why Wipo is involved in an area like this around open innovation, particularly for infectious diseases.
Very well. Wipo is part of the UN family, and as part of the UN family, we are promoting the Sustainable Development Goals, and we're working to advance the global health agenda with our fellow institutions right across the family of UN. But Wipo, the focus on, I think there's a recognition that these problems are incredibly vast, incredibly complicated, and everybody has a role to play. One of the things I've noticed when I was working as a diplomat, I would often go to specialists conferences, would follow many different things, and you'd get very, very, very technical specialists speaking with one another. But there's nonetheless a need to kind of connect the dots and the bigger picture. And that's one of the things that Wipo does with Wipo Research. We target the neglected tropical diseases, malaria and TB, for a couple of reasons. One is because they're primarily diseases that affect poor and disadvantaged populations around the world. And two, because these are diseases that don't generate the market investment that is needed to come up with the discoveries that are requisite. So we very, very specifically focus on those two, and our goal is to bring the resources of the private sector into the hands of scientists that need it. And so this whole project, the Wipo Research Consortium, started out about 10 years ago, and it was just an idea. We reached out to the big pharmaceutical companies. We currently have 8, including Merck, of course, of the world's leading pharmaceutical companies, and we asked them, would you be willing to open up your asset libraries, your compound libraries, your molecules, and let us look through them and possibly identify ones that could be repurposed for research on NTDs, malaria, or TB. Companies said yes, they'd be interested. We started out with a handful of academic research institutions, roughly 30, 32, back in 2011. Today, the network has grown to 140 plus, or actually 150 plus institutions. We're in 43 countries around the world and on 6 continents. So we've definitely hit a very particular niche, and we have demonstrated the value that together, bringing the private sector, industry, the United Nations, the diplomacy angle, together with the global health community, we can help advance our common agenda, which is really to help people everywhere lead healthier lives and have a higher quality of living.
Perfect, thank you. So I also want to segue to Ben now, who also works in a, kind of this public-private partnership, more from a PDP, product development partnership. But, so how is, you're sharing IP as well, right? But to enable innovations in science for these diseases, neglected tropical diseases, that are often not addressed through a traditional, commercial model of research and development. So I'd like to get your perspective from a different angle.
Sure. So I guess I should preface this with the DNDI view, or the DNDI vision is, with regards to IP, is quite flexible and different from disease to disease. We believe that it is possible, for example, to get a new medicine all the way through to patients without, in theory, having to take an intellectual property position. Because these are neglected diseases, the commercial angle is, there's no incentive to work on it commercially, and so in an ideal world, there's no reason to have a defensive patent. There are some situations where that might not be the case, and in those cases, we may look at using IP to be able to help us out, or to be able to incentivize the participation of some of our collaborators, provided it doesn't block the access through to the patients and the equitable access to those medicines. So I guess we see IP as a tool that allows us to really leverage these different sorts of collaborations, and I mean that in 2 different ways. So one thing I've noticed is that particularly in very early stage discovery work, particularly where you're talking about future scientific discoveries, the whole question about IP and IP ownership and data ownership can often become more complex than the actual science itself, and can really be a barrier to actually certainly getting going. Once it's resolved, and once you have everything written down on paper, things go very, very smoothly. But getting to that point can unfortunately take years in some cases. And that's not just with commercial entities, but particularly with universities who are under pressure to make sure that they valorize their own intellectual property. So sometimes by taking a position where we say, okay, we're not going to take any IP, we're going to work very much in the open. So using the open in open innovation to mean open science to the public, thus basically almost invalidating the IP situation by putting the prior art out there. That really enables us to get up and running and working on projects very, very quickly. And we have some really interesting successes in that space. So I run a project where we have chemistry students in labs making molecules all for the same project. So 25 different universities, ranging from the University of Otago in New Zealand, University of Ghana, a couple of universities in the UK, a couple of universities in the US, the University of Geneva here in Switzerland, all working on the same research project collaboratively. And that's been enabled by the fact that the agreement is there will be no IP taken on this position. On the other hand, using the IP handle, particularly with commercial organizations, is a way that you can kind of incentivize people to collaborate. So when you embark in early stage science, particularly, you don't know what you're going to uncover. You hope to uncover, the ultimate goal of, let's say, a new molecule, but you might find some sort of interesting process as a sort of an offshoot of some of that work. And by having, very clear defined rules about IP and ownership of that IP, particularly for these, side processes, the things not necessarily linked to the actual discovery of the molecule, but things you might come across on the way or potential other future uses of a discovered molecule, really incentivizes partners to work, particularly with DNDi. So, IP and science, it's a really complex interface, and you can use both and tune both to be able to get the maximum benefit and the maximum leverage from the different partners.
Excellent. Thank you, Ben. I'd like to build on a point you mentioned about academia and IP, and I'd like to turn to Kelly. So from an academic perspective, what is the view on intellectual property, and what is the link with research and innovation, right, to support and advance open innovation?
Yeah, thanks, Natalie. So when people talk about IPR for intellectual property rights, I also use the R to say it is not just intellectual property rights, it's also intellectual property responsibility. So for somebody in academia, the responsibility is to the patient. In other words, securing that intellectual property and managing it so that the patient has access to it. And I think my colleagues have already mentioned this already, Charles and Ben. This is not about commercial reasoning here. It really is about ensuring access because we have a responsibility to the patient. But also to remember this, that at some point, you're gonna need development partners. And an example of this would be a pharmaceutical company, just as an example. There could be other potential development partners where you get to a stage along the process and the value chain where you will need a significant injection of resources. And what you want to do before you can bring in partners to help you with the development is to ensure that the IP is secured. Why is that important? Because it gives the pharma company, if that is your development partner or another partner, freedom to operate. When there is no IP, there is no freedom to operate. And I think it's very important because otherwise you will not be able to attract development partners to come on board. The other reason why a development partner would want to see IP secured, in addition to having the freedom to operate, is also that this is what will help them to ensure quality and protect their reputation as well. I think that's very, very important. And then the second point is what I already alluded to. But because it is a responsibility that we have to the patient, we have to ensure that there is access to that medication here. And so you can actually then control the licensing strategies. Because you have the IP, so you have a say in the way that the licensing is conducted. And so therefore you can influence that process. And I think the other thing that people forget about IP, even for things like malaria where there are no commercial returns really, is that actually that is one way to influence the pricing of products. So this is what I keep saying often. In the developing world, you see, people can think about generic medications, but generic medications are not a solution because all it takes is for a disease that you've been treating for decades for resistance to emerge. That medicine is rendered useless. So you will always need innovative medicines. And so one way to lower the cost of medicines is actually to own the IP, because you can influence that process of doing that. So I think overall, from an academic perspective, that's why IP is important.
Thank you, Kelly. This is really interesting and adds depth to the topic. Now I turn to Toma. So a key theme emerging has been open, right? Openness. And so really over the last decade, companies like Merck have been more engaged in this area, open innovation, open collaboration, particularly for infectious diseases. So why?
So first of all, why in global health, right? So as a responsible science and technology company dedicated to human progress, I think it's important to commit resources in areas that are not so, not so well funded, like infectious disease research. Second, why open innovation is really because we believe that innovation occurs at the scientific interfaces and at crossroads. And on top, by collaborating, I think we can actually pool resources and make the model more sustainable.
Excellent. Thank you. So, all right. So we've had intellectual property, science, openness as key topics that we've been discussing. Another key theme that keeps emerging is collaboration. It really seems in this type of model, no one can go it alone. You could, but yet there are certain fruits that we're able to reap by working together. So, Tom, I want to keep going with you in terms of why isn't a private sector company like Merck doing this alone, right? We could technically, if we wanted to, do the research and development on ourselves, but yet we're choosing a more open model, a collaborative model.
Right, I think it's being realistic, right? And we have a know-how is developing drugs, and we have to also admit that we have limited competencies. Our core focus is not infectious diseases, so we really rely on collaboration with our partners to be able to run that together. I think that's reality.
Excellent. And Charles, so in Wipo and Wipo Research, you already touched on in terms of the network you've built, right? Mm-hmm. So, can you delve into a little bit more about what was the need for this, right? There was a niche and a need that was really identified sort of more in the beginning of the last decade, right? And what is the value that this connecting brings, right? There's a certain element, there was a gap there that now is being filled by Wipo Research.
Well, the gap was a lack of investment. As Kelly had mentioned earlier, in many of these diseases, there's very little incentive to invest. So we looked at that problem and we said, what can we do, thinking creatively, perhaps outside the box, to help bring resources to those disease categories. And that's exactly what we did with Wipo Research. The companies were very willing to help out, and the benefits really go in both directions. I mean, for the companies, for example, they have access to a network of experts and specialists and data sets that that saves them time. They don't need to devote human resources to looking for these. They can ask us and we can immediately connect them with an expert. For the research institutes, they have the opportunity to gain access to incredibly rich resource libraries of molecules and compounds at these companies. So it's really a win-win situation for both, and the benefits flow both ways. It's not just north-south, it also goes south-north.
Interesting. This is an important point that I want to get to a little bit later in the discussion, but I'm really happy you raised it. For now, I'd like to go to Ben, because he also, in his organization at Drugs for Neglected Diseases Initiative, you work at this intersection, public, private, academia. You're working with a lot of different partners and trying to bring it together to some sort of fruition, right, to develop, right? So what has been some successes and lessons learned, right, from working together with different types of partners?
It's a great question. I think it's exemplified by one of the projects that we've been running that Merck have been part of, which was is the drug discovery booster that we've been running in the discovery group at Dndi. So this is, I guess, in a similar thinking to the idea from Wipo that Charles mentioned earlier. Accessing drug companies' libraries. All the big drug companies, all the big pharma companies have these vaults filled with molecules that they've made over the many decades. All of these are, almost trade secret levels of confidentiality attached to them. They tell the history of the work that those companies have done, and it's quite difficult to tap into those resources. And we came up with a project that brought 8 different companies, Merck included, some companies in Japan, companies in the US, all together to actually share information on those libraries to help work on neglected diseases. So this wasn't just accessing those libraries, but accessing those libraries in a way in which results and interesting findings from a library coming from a company in the US could be shared directly with a company in Japan to allow them to be able to make improved searches and improved scientific changes to the project. And this has been very successful. We've been running this for about 5 years now. It's allowed us to prosecute a whole host of different scientific avenues in leishmaniasis and Chagas disease. It's given us some very advanced projects. We've got a whole host of publications that we're currently writing that are coming out of this. And those sorts of collaborations, although difficult to put in place to begin with, particularly because of the understanding the IP and the confidentiality, because these are companies that normally would certainly not collaborate, let alone share information with each other. Once it was up and running, it was very, very exciting to be able to have partners from many different organizations in the same room. Tapping into expertise from different areas is really important. And what you'll find, one of the things that we've learned at DNDi is that not all big pharma companies think alike. If you have someone from company A in the same room as someone from company B, they may both be medicinal chemists, for example. They will have very different viewpoints on how to do science. And so by bringing as many different scientific experts into a room to tackle a single project as possible, you get some really interesting, informative decisions. And also that's kind of where you kind of catalyze innovation when you start bringing these clashes of ideas together. I think one of the other panelists mentioned this earlier. So these sorts of, what we can learn from that is, first of all, there are ways that people can impact global health, even though it may not be immediately obvious. But also, there is a huge amount of benefit from tapping into multiple collaborators, because although some companies may be large enough to do this themselves, the more the broader the array of scientific minds that you have looking at things, the better the quality of the science that comes out and the more chance for innovation. And that's not obviously not just limited to pharma companies or commercial entities, but when you bring academic groups into the discussion as well, when you bring people from government labs in, when you bring funding organizations, when you bring people coming, thinking from the government perspective, and you get some really interesting findings and some interesting discussions. And that's really why this interface is a great place to work and really of benefit to the DNDi model, certainly.
Excellent. Thank you, Ben. And you did mention about academia. And so I'd like to turn to Kelly now, because in the end, what we have is we've created, this sort of nexus of partners, right? Public, private, academia. We're trying to really work towards helping to address these diseases. And for a scientist such as yourself, who lives in a country where these diseases are endemic, how do you deal with this nexus of partners, right? I mean, this wasn't always here, so has this been helpful? And also, what could be done better to help scientists such as yourself, to achieve your objectives and reach towards, finding new treatments for these diseases?
Thank you, Natalie. So as I mentioned earlier, the network of partners model that I'm involved in is not just involving academia, the private sector, and a not-for-profit entity, but also government specifically. And I'll come back to this a little bit later when I talk about what works better. So the South African government in this case is a partner in this, and it's not just a partner in name, it's a partner in substance, as I will describe now. So in terms of how I manage this or deal with this, I really see this as a mutually beneficial arrangement at the level of, as Thomas was saying at the very beginning, not just sharing data and knowledge and expertise, but in this case, and this is why I mentioned the South African government here, was leveraging resources. And I think the way that this has happened for the projects I've been involved in, and I mean, just to give an example of one project that is supported by the Bill and Melinda Gates Foundation, and one project supported by Medicines for Malaria Venture. In both of these Gates Foundation and MMV funded projects, government provides matching funding. So for every dollar we get from the Gates Foundation, we get $1 from the South African government. In fact, our Drug Discovery Center, H3D, is actually a national platform through the government's Technology Innovation Agency, or TIA, which provides core funding to maintain the platform, upon which we can then attract projects that we prosecute with Merck and Thomas and his colleagues and other partners. But the point here is that without the platform, which is supported by government, but also over and above support for the platform, we get actual project funding to match the money from the Gates Foundation and money from MMV. So that's how I see this as a mutually beneficial arrangement, because we can really leverage resources and grow the pot of money, and of course increase the chances of success. But in terms of what I think works well, based on my experience, especially of working with MMV over the last 11 years or so, is when you have this partnership coordinated and managed in such a way that there's a strong mentorship component, which really ensures capacity building on the back of prosecuting the project. The project has clear deliverables. We're going to deliver drug candidates, that's for sure. But there's a very strong mentorship component, which is really critical to capacity building, which I'm sure we'll come back to a little bit later. Because I think it's really important that for these kinds of diseases, as Charles, I think, was alluding to earlier, we gotta involve the disease endemic countries to meaningfully participate in contributing solutions to these problems. So one way to do it is to empower them and build that capacity while they're getting the job done on the discovery project. And then finally, you asked me what could be done better to help scientists like myself. I think it's two things for me. One is already something I've already mentioned, is that in fact, it will be important for the partners, whether it's the private sector, for example, Merck or MMV, to embed capacity building as in the strategy of prosecuting projects. Yes, it's always going to be about prosecuting projects, but there must be an intentional, deliberate effort to embed capacity building in the strategy, because that's what is going to help sustain this kind of work in global health, is building capacity in disease endemic areas, but of course, getting the job done. And then finally, it's really for the partners, academia, the private sector, not-for-profit entities, governments, to work together to really build sustainable research and development infrastructure. This is really critical. One of the problems, I mean, I can't speak for the whole world, but I can speak for my continent of Africa. I think infrastructure is a real challenge. And when I talk about infrastructure, I am not just referring to a physical building. Infrastructure is more than a physical building. I'm referring to things like, for example, a functional laboratory. I'm referring to things like, can you procure chemicals and reagents and get them delivered to you in good time? Because remember this, drug discovery is about making decisions quickly so you know what to do. So if we don't improve that infrastructure, we're not going to be able to sustain what we do. So it's functional laboratories, equipment that can be serviced, ways of buying chemicals and reagents much more quickly. And then finally, the partners must work together to create an absorptive capacity to attract and retain talent. We cannot continue to this day talking about talent from Africa going to Europe and North America, when in fact, the reason why they leave is obviously because we can't retain them, we can't attract them. So I think it's in the best interest of everybody else. You're having issues with immigration in Europe or North America. Part of the problem is that we haven't worked together to really create an absorptive capacity to attract and retain talent.
Kelly, thank you so much. I want to build on this point around capacity building. And you're touching on this paradigm that we often talk about in development, sort of, your traditional global north and the global south, right? But it's also not just the one direction, right? This is a mutual relationship because we also, even if you're in Europe or you're in North America, you still have a lot to learn from scientists such as yourself who are working in these countries. You've had to sometimes be, novel in your approaches in terms of how you do research and development. So can you share a little bit more also in terms of, there is countries in sub-Saharan Africa can bring value, can bring knowledge also to those researchers in the north. Can you touch a little bit on that too?
Thanks, Natalie. And actually, even before I get to those points you've asked me to touch on, I want to say this up front. I am a firm believer that the best way to build capacity is to prosecute projects. It's really, really
Okay. All right. So, Charles, we'll turn to you as we work out some technical difficulties. So, a little bit building. Okay. So, we'll let Kelly finish. Sorry, Kelly, technical difficulties.
Okay. No worries. These things happen. Yeah. So, I was just saying that the best way to build capacity, in my experience, is to actually prosecute projects. It's building capacity while getting the job done. It's job on training. So to me, before I even respond to the question you asked me to respond to, capacity building to me means to be equipped through experience with the ability and the tools required to successfully prosecute a drug discovery project. I want the tools and the ability to do that successfully, and that can come from experience. So what Charles was alluding to earlier from a Wipo perspective, normally things have always been south to north. And of course, we heard what Wipo is trying to do is also get north to south type of interactions. And I think this is very important for two reasons. Firstly, I think people need to understand that there's a very direct correlation between the physical and socio-economic environment of a patient and effective treatment outcomes. So it makes sense to make the center of gravity the disease endemic country. In other words, bring that capacity closer to the patient. And I think it makes sense. But also there's something to learn by the industry. When you understand the disease and the medical needs in that environment, in that population, it is of tremendous benefit to the industry. And I want to give just one example to finish off in terms of why it's really important that these exchanges happen in both directions. And this is the example I can give through a partnership we've had with Novartis, where on one level, we look at what we have in Cape Town and what we don't have. We identify the gaps that we have. We then partner with Novartis and address those gaps by sending our staff scientists to spend time at any of the Novartis sites across the globe. But it doesn't stop there. It also goes the other way around. We've been able to host scientists from Novartis in our environment in Cape Town that come and not only learn from us in terms of what we do on the ground, but also there's an added advantage in addition to them learning about what we do, but also they have access to more people they can influence on the ground, as opposed to if we sent one person to Basel or one person to Cambridge, it's just one person. Whereas if those people come here, they have more access to more people to help. And I think what this does, by the way, is it provides continuity. It provides continuity because it doesn't stop with the scientist who goes to Novartis. That is a bi-directional relationship that is mutually beneficial for all parties involved.
Thank you, Kelly. Those insights are really unique. And I'd like Charles just quickly to also delve into, as Kelly was saying, Wipo has been doing work in this area. And so can you just share a little bit about what you've been doing in the area of capacity building for this space?
Well, sure. Since we started, we've put together over 160 collaborative agreements, of which roughly 50 are continuing. And these agreements, in fact, I would say probably the majority of them involve resource-rich countries with low and middle-income countries or less developed countries. And those relationships, those collaborations, they don't just end when the collaboration ends. If you have a team of scientists working on a project for 6 months or a year or 2 years or 4 years, when the formal project ends, with or without the desired result, those relationships stay. And that in and of itself is a tremendous value added. And I just want to touch a bit on one of the points Kelly mentioned, is that we find it's really the know-how and the expertise and the understanding that many of the scientists in the endemic countries bring that is tremendously insightful for the scientists in some of the more developed countries that are working on these issues. So there's been a tremendous flow of information in both directions, and I think it's those long-lasting relationships that get built, where people can then after pick up the phone and call or send an email and ask a fellow scientist, I'm having problems with this. What do you think? What are you doing? Those types of things are largely invisible when a formal project concludes, and yet they're so essential to advancing the needle of science in these disease categories.
Thank you. Ben, in terms of advancing science, I know DNDI, you have offices not just in Geneva, but regionally. And so, how are you trying to build capacity where you're present, in this kind of sustainable fashion?
Sure. So I guess I can touch on a couple of examples. Obviously, some of the diseases that we work in, if I take, for example, human African trypanosomiasis or sleeping sickness as an example, we've been working very heavily in the clinical space in that area, and the patients for those diseases are in mainly in the DRC and in the Central African Republic. To be able to do a phase 3 clinical trial in that disease, you need very well trained clinical specialists and clinical technicians, and they don't necessarily exist in those countries. So one of the things that we've had to do as part of those running those clinical trials, which we have run phase 3 trials successfully and registered new medicines in the last 2 years in that space, that's been done in parallel to training hundreds of local staff to be able to achieve good clinical practice level research stuff, that the sort of work that allows you to be able to register molecules with the health authorities, which is a not particularly easy thing to do. And that's a key part of the work that we do in the clinical space, actually training up people to do the clinical work in the areas where the diseases are endemic, because there's not really any other alternative. On the other end of the spectrum, in terms of research, I agree 100% with Kelly's point about, if we're talking about capacity strengthening, the way to do that is projects, right? Drug discovery is not really something that gets taught in the classroom or gets taught by lecture courses. It gets taught by doing. And so we try to push as many of our projects out to involve either completely or partially researchers in those disease endemic regions. About 5 years ago, we set up what we call LOLA, Lead Optimization Latin America, which is a key part of our discovery team, where we try to do the entire drug discovery project through researchers that are based exclusively in Latin America. And to begin with, that was quite difficult, because there are certain parts of the team, some of the multidisciplinary team components, that just aren't really necessarily there. So we were able to fill those in by bringing in partners, for example, in Belgium or in North America, to sort of fill those gaps while we sought to train up or identify providers within those regions. And we now, that group is now entirely self-sufficient and is able to do the whole discovery process purely in America. And now we're trying to do the same thing in India, where the capabilities are all there. It's not a case of building capacity, particularly in India. There, it's more what I would call network strengthening. It's not capacity strengthening, it's network strengthening. It's giving all of these researchers the opportunity to connect with each other, but also with other researchers across the globe, because again, we come back to it. It's all about collaboration, and the more different mindsets that you have on these projects, the better it is. And there's a huge component of scientific research that is linked to networking and working with others and having a broad network. And we try to work very hard to make sure that we can strengthen those networks, particularly with researchers in the endemic regions, as Kelly and Charles both mentioned. I think there are some fantastic examples of that's ongoing. And we'll be turning our attention to some of the other regions that we work in very soon.
Excellent. Toma, and also from a private perspective, right? Companies are partnering in this area of capacity building. So can you give a little insights why, and maybe an example of how you're doing this?
Sure. So Kelly nicely mentioned that we have already embedded some capacity building in our program here. I'll give you another example, which is more about providing researchers with tools to play with. So we recently launched an initiative called the Open Global Health Library. As you know, pharma has a lot of assets sitting on their shelves. And what we did, we brought them together into a nice plate. So researchers can actually request it free of charge so that they can test it. So I think a lot of researchers are in demand of having things to research on, right? And so that we recently launched, and we hope that most of the research in low and middle income country will request it. And so that gives the first step, right? So we have something you can play with. The second one is something comes out of that research. And here, the scientists will, of course, retain and own his results, but also will be able to file IP, so get an ownership on his innovation. And that, I think, is a key element in a sense that this will help more homegrown innovation to happen, in fact. So this is, from my perspective, what could be a way to go.
Excellent. So yes, a lot of openness, a lot of collaboration. So we're going to quickly wrap up before we open up to the audience. And maybe I'd like to take 30 seconds from each of the panelists to get your future perspective on this area, right? We've kind of rehashed what has happened over the last decade or so in terms of this new open model. And so where do you see it going, open innovation for infectious diseases, and if you'd like, beyond? So let's start. I'll start here in the studio with Charles.
Thank you. I think we see open innovation with neglected tropical diseases, malaria and TB continuing, definitely, much as it has. And we're certainly at Wipo, we're certainly open to considering the addition of other diseases, provided they meet our criteria in terms of development, in terms of capacity building, in terms of helping channel resources to areas that might not otherwise have such resources. I briefly mentioned next year, 2021, is our 10th anniversary year, and as part of that, we're going to be conducting a very in-depth strategic review of how the program has been working and posing some serious questions on how we want to move forward and go into the next decade. And we go into the next decade with an open mind and with a lot of excitement.
Okay, great. Thomas.
Right, so you realize that from we are in the middle of a pandemic. You see how important infectious diseases are, and performing research under an open innovation umbrella is probably the way to go, I think. Also, there might be on the long run some learnings and maybe some crossroads between, I would say, NCDs like autoimmune disease, for instance, in relationship with infectious diseases. And also, just a quick side note to remind everyone, like the Nobel Prize of Chemistry this year, actually, the Swiss knife of gene editing actually stems from infectious disease research. So I think it's still important to keep that on the radar.
And Ben, from a Dndi perspective, any plans in the future, expansion of disease focus, anything in those, or maybe you can't reveal, but whatever you can tell us would be great.
No, so I mean, obviously the WHO NTD list is very large, 20 different diseases. We work on maybe close to half of those. It's constantly evolving. We've had a lot of successes in leishmaniasis in the last couple of years. So as that moves further down into the clinic, we'll possibly be looking at other diseases to bring in. I think, though, the answer to this question today is different to the answer to this question a year ago, right? I think hopefully in a couple of months, if not 1 or 2 years, we'll be able to look back on this period, and there'll be so many learnings to take from how the world responded to the current pandemic. As Thomas mentioned, I think that's going to be a game changer. The point at which we can sit back and review how these many different approaches to tackling this sudden pandemic have panned out, and whether these global collaborations that you'll see worked, or whether it was really the lone researchers and the lone companies that were really successful. I think that's really going to impact the future of open innovation in certainly in infectious diseases, and obviously the buzzword is going to be the pandemic preparedness, how to make sure that we're better equipped next time around. And certainly DNDi are very much focused in that area.
And Kelly, we need your sage expertise, experience in this area. How do you see it evolving from an academic perspective, but also just in general as someone who's been following this area?
We've been talking about neglected diseases, tropical diseases. But let me tell you, COVID-19 has reminded us about neglected viruses. And so, as Thomas was saying earlier, this is not just a reminder of the importance of investing in infectious disease drug discovery, but what COVID-19 has done is actually catalyzed new ways of developing partnerships. And I think this pandemic, because it's affected the whole world, has provided a blueprint of how to prepare for future pandemics, and actually suggested new avenues of how we can address unmet medical needs. So absolutely, this is going to continue, and even more. And maybe one day we're going to thank COVID-19 for having catalyzed this process.
Okay, excellent. So we have a few minutes left, but we do have some questions from the audience. And so a topic actually that has come up is the current pandemic, right? The current COVID pandemic. And so there is a question in terms of, has the pandemic affected the priority of neglected tropical diseases globally? So this is less than a year, and sort of how is this is your space being affected negatively or potentially positively? I open up, I don't know if any one of you want to chime in on this, Kelly or Thomas?
I mean, the experience is that a lot of organizations have refocused their funds on COVID-19 to respond quickly to an emergency, right? Which then, of course, lowered, I think, a bit the neglected diseases investment. So this is, I think, my view.
Kelly, anything to add? Then I'll come to Charles.
Yeah, I think my view is, in addition to what Thomas mentioned, I think there's a positive aspect to it, which is a reminder that we've got to fund infectious diseases. So that's positive. But secondly, we see, and this is really a fertile ground and opportunity, what is the impact of COVID-19 on other diseases, malaria, TB, and vice versa? So for me, I see two positives: a reminder that we cannot ignore infectious disease. Secondly, there are open scientific questions. What is the impact of this pandemic on other diseases, and vice versa?
Charles, anything to add from the Wipo perspective?
Well, briefly, I think the neglected tropical diseases have become, and perhaps understandably given the current conditions, more neglected, and so there will definitely need to be a continued focus on them. But then also to touch on a positive, we've heard from many of the researchers that we've been working with that the skills and the capacity that they have developed working on NTDs and malaria and TB over the past decade with us have been tremendously useful in enabling them in an emergency situation to switch gears and work on the current pandemic. So there are positives, and I think the relationship between these two, as Kelly had mentioned, is very important to look at.
And Ben, from a DNDi, has pandemic, kind of preparedness, particularly around COVID, come up, or are you mostly focused still on the daily work of NTDs?
So we were actively looking into pandemic preparedness before the COVID-19 situation, and we released the pandemic response box as a project with MMB. We are actively working in that space. We have the Anti-COVID Consortium in Africa we're running phase 2 and phase 3 trials in COVID-19. So we are active in that space, and as an outcome of that, the whole pandemic preparedness and tooling ourselves up ready for the next emerging pandemic, whether it's viral or other, is going to be I say a very hot topic for us. I think one of the fears I've shared is that in the short term, one of the impacts on this, particularly on the patient side, I've heard this for TB, is the worry that the mortality rate for TB in 2020 is going to be way above usual because of the fear of patients going to the doctor in the COVID-19 space. And I think that's, I've heard that across many diseases, but I think that's going to be particularly heavy hitting in sort of the global health arena. So potentially maybe in the mid to long term, that the impact is going to be a renewed focus in the global health space, and maybe an increase in looking at those diseases when the current pandemic has cleared. And I think we're going to learn a lot from the way the world has responded to this situation, and hopefully this idea about collaborative approaches to tackling global health issues is going to become even more prevalent in people's minds.
Thank you, Ben. So we're at the bottom of the hour, so our session is done. We'd like to really thank everyone who joined virtually. Also, a special thank you to our panelists, both in person, virtually. We hope everyone stays safe. Our information is on the Geneva Health Forum website, so if anyone has any questions, don't hesitate to contact us. Unfortunately, this is all the time we have for today. Thank you very much and have a great day.